We are so happy that you are interested in doing residency here at Rush. Our goal is to educate and train the next generation of anesthesiologists to be well-rounded, competent, confident, and ready to be leaders in our exciting field.
I've been at Rush University for the last 30 years. I started off here as an intern and did my residency here and completing my fellowship. And then I've become on staff since 2000 to a chairmanship in 25. It is a privilege to meet each and every one of you because I have been through this process and I interact with the residents regularly in the operating rooms and in my administrative office.
I really think that the big advantage of Rush is that you get comfortable with independence quickly. The faculty have a lot of trust in their residents, and I really think that shows when you rotate elsewhere and you see residents from other programs. You realize that we really are able to gain a lot of confidence here.
If you come to Rush for residency, you will gain a rich and comprehensive education that is grounded in clinical excellence, cultural competence, and procedural versatility. Training at Rush encompasses a very diverse patient population across age, gender, health status, and socioeconomic backgrounds. There are a variety of procedures that also happen at Rush University. These range from simple outpatient surgeries to complex high acuity operations in cardiac, neurosurgery, transplant, and other surgical subspecialties. We have a robust curriculum that involves morning keyword discussions, board review questions, a weekly grand rounds presentation, a visiting lecture series, and advanced skill workshops focusing on difficult airway management, advanced regional skills, and POCUS techniques. We also have access to a state-of-the-art 20,000 square foot simulation center that allows residents to be educated in a challenging, safe educational environment.
So the residents in our anesthesia program learn a little bit of everything. Our intern year, you do some surgery rotations, you do critical care, doing some ICUs, cardiac ICU, surgical ICU, and then you also do medicine, and then you start with your intro months into anesthesia at the end of intern year, where you learn how to be a really competent anesthesia resident, and that also includes working on OB, doing epidurals, doing C-sections, or doing regional blocks, or learning about pain control.
So the quality of training is unmatched. You get to interact on a daily basis with nationally recognized anesthesiologists, in addition to providing a research environment in our labs.
Rush has really provided me a lot of opportunities, especially being interested in chronic pain. We have a very robust and well-established pain program here at Rush University, doing everything from seeing very complex pain patients, post-surgical patients with a lot of chronic pain. We do a whole host of procedures, including simple bread and butter nerve blocks, but also very advanced cases, including spinal cord stimulators, intrathecal pumps, DRGs, everything you can think of when it comes to chronic and interventional pain.
The attendings are really great to work with. They're always just a phone call away. They get to know you on a personal level, and they really care about your academic success. And then the mentorship program here, we're all split into groups, and you are each paired with an attending, and you get together every once in a while throughout the academic year just to commiserate and, just talk about things you need help with, or just be a friend and have an ear to listen to.
This is the most fun specialty you can do. Once you kind of get past that initial stage of being in the OR by yourself, which is a little bit scary, after you get past that and you realize that, you can do things, that's a great feeling. And you have support, but your attendings aren't afraid to push you a little bit and get you out of your comfort zone a little bit and do things that you may not realize you can do, but they know you can do.
Our graduates are routinely sought after because they are ready to handle challenging cases on the first day of their job or fellowship. We also have some exciting wellness resources that are available through Rush's Center for Clinical Wellness. These include stress and time management, career goal achievement, counseling service, and childcare. And within our department, we have an active wellness committee that plans numerous events throughout the year.
We have a really good work-life balance. We get almost every weekend off. The only time you work on the weekends is if you're on call. And then we usually get out at a decent time during the week. Our program hangs out together a lot outside of the OR. We like to go out and have a good time with each other, whether it be like playing pickleball or just having a happy hour. Or we do a lot of journal clubs, so it's kind of academic, but then you're still having a good time at a restaurant somewhere while also learning. And then we also just have mentorship meetings where we get together.
We have a long history of developing very sought-after residents, whether it is for fellowship, an academic position, or a private practice physician. Our recent graduates have matched into very competitive fellowships, including cardiac anesthesiology, interventional pain management, critical care medicine, pediatric anesthesiology, regional, and OB anesthesiology. And looking at where our recent graduates have obtained jobs, it has literally ranged from coast to coast and everywhere in between. I think that's one of the great things of graduating from a large, nationally recognized residency program like Rush.
Rush, because of the family-friendly environment that we have created at the university. Every patient is important to us, and therefore the entire clinical practice is centered around the patient. As such, I feel that the entire university and the department and the perioperative team is centering around the patient to provide clinical excellence.
Once you graduate, you are now part of a very large Rush family that is interested in helping you start and flourish in your career. After watching this video, we hope that you explore our website to have a few more questions answered. We look forward to hearing from you and perhaps meeting you on one of our exciting interview days.